Now to a Target 12 investigators exclusive, the impact of opioids. Today marks International Overdose Awareness Day as opioid overdoses continue to take a deadly toll in Rhode Island with 434 accidental overdose deaths last year. Starting next spring, a controversial overdose prevention center will open in Rhode Island aimed at preventing deaths.
Target 12 investigator Kate Wilkinson talks to proponents who say the facility will save lives, as well as those who say it's not the answer. Kate joins us now with the exclusive details.
While people will be able to use substances like heroin here, a recent review of places from around the world found that safe injection sites have had 0 deaths. And in countries like Switzerland and Canada, they've had facilities for decades. In 2021, Rhode Island was the first to legalize overdose prevention centers in the United States, with New York opening the first 2 locations in the country, making this spot here on Huntington Avenue in Providence the 3rd legal site in the nation. The building abuts an auto salvage yard, train tracks, and Route 10.
All of this will come out. None of this is load-bearing.
Target 12 took a tour before renovations begin later this year, with the goal of opening in this spring. Linda Hurley is the president and CEO of Kodak Healthcare. She says people can test their drugs here and use sterile equipment to administer the drugs.
A glass panel here, and then what they refer to as booths, and it's just where people can self-administer, whether they're smoking, whether they're using needles.
Dennis Baylor is the overdose prevention program director at Project Weber Renew, which is collaborating with Kodak to get this overdose prevention center. He says a medical professional will be ready to step in if a person overdoses.
People will be right there to administer life-saving oxygen and Narcan if necessary, although it's not always necessary. We find that if you intervene in overdose immediately, you don't even need Narcan.
They point to research that shows quick responses save lives. A report from the Institute for Clinical and Economic Review, a nonpartisan think tank, found no one has died at any of these sites that it has analyzed across the globe. Hurley says offering these spaces for people to use drugs not only keeps them safe from dying, but also crime.
And especially with xylazine, so prevalent now, it's like being in a really deep coma for a few hours. So people are getting assaulted, they're getting robbed, they're getting raped.
Safe injection sites have faced opposition in Rhode Island, among them State Senate Minority Leader Jessica De La Cruz.
We do need to provide help for these individuals. We certainly don't want to see anyone perish and hurt themselves, but recovery should be the ultimate goal.
Dennis, who is in recovery, says people who want to use drugs will do so, whether they have a safe place to do it or not.
We're losing too many lives. The things that we've been doing in regards to substance use disorder and overdose just have not been working for many, many years.
Coming up at 6, I'll have why research says it's so crucial for the location to be here in responding to the opioid epidemic, and how these sites fare in putting people on the path to recovery. With the Target 12 investigators, Kate Wilkinson, 12 News.
With Target 12 investigators exclusive, the impact of opioids. While Rhode Island remains locked in a fight to end the opioid epidemic, a controversial tool is being brought to the front lines: safe injection sites.
People will be able to use their drugs at the new center under medical supervision. On International Overdose Awareness Day, Target 12 investigator Kate Wilkinson shows us where the first one in Rhode Island will go and why local experts say the location they choose may not be random. That's new at 6.
The state is calling them overdose prevention centers, with the first one going right here in Providence at the Kodak Healthcare building on Huntington Avenue. But this also is the epicenter of accidental overdose deaths in the city. Dennis Baylor is the overdose prevention program director at Project Weber Renew, which is collaborating with Kodak to open the first center in the state.
The people who are using will use. We're not changing that. They're going to be using. But I don't want to see any more of our citizens dying in these horrible places.
There has been little improvement in the crisis so far. In 2022, 434 people died from accidental drug overdoses in Rhode Island, almost exactly the same number as the year before, which was the highest year on record. Linda Hurley is the president and CEO of Kodak Healthcare. She says there's a reason why they're using this building on Huntington Avenue.
This area is what they call in Rhode Island a hot spot, and every week we identify a different hot spot. It's consistent here, particularly with not just overdose, but death.
And when it comes to preventing overdose deaths, the impacts can be measured. A 2021 review in the National Library of Medicine found multiple studies that determined safe injection sites lowered the risk of people dying from overdoses, including a 2011 study out of Vancouver, which saw a 26% net reduction in overdose deaths in the immediate area compared to the rest of the city. And while the Canadian government reports roughly 47,000 overdoses and drug-related medical emergencies at their site since 2017, no one has died. Yet some are skeptical of how it will be implemented here, like Rhode Island Senate Minority Leader Jessica De La Cruz.
I would be able to support it only if it were part of a recovery plan. Someone's on the path to sobriety or to getting clean, then I could support it. But if we're just offering free injection sites so that people can use drugs, I don't support that.
Hurley says while this will be a space free of judgment for those who do plan to use drugs, meeting people in those critical moments can be a key piece in helping people get on the path to recovery.
And there is a much higher level of people engaging in care for these alternatives if that care is right at the spot, the physical spot and the time that they requested.
Rhode Island is the first state in the country to legalize safe injection sites. And with this location opening sometime next spring on Huntington Avenue, it's expected to be the third in the country. With the Target 12 investigators, Kate Wilkinson, 12 News.